Hi, I'm Dr. Sarah Collins, and if you're over 40, 50, or beyond, you need to listen carefully, because what I'm about to share could save your legs, feet, and nerves from permanent damage. Many seniors think that taking a simple vitamin B12 supplement is enough to protect themselves from numbness, tingling, weakness, or that burning pain in the feet and legs. But the truth is shocking. Over 60 to 70% of seniors are taking B12 the wrong way, and while they believe they're safe, they're actually putting themselves at risk. By the end of this video, you'll understand the 7 biggest mistakes most people make with B12 supplements, the serious consequences, and exactly what you should do to actually protect yourself. Trust me, you don't want to wait until it's too late. Vitamin B12 is absolutely essential for nerve health. Without it, your nerves start to suffer, causing peripheral neuropathy, numbness, tingling, burning sensations, and weakness that usually begins in your feet and legs. Millions of Americans take B12 supplements, and seniors over 60 are the largest group. But studies show that most are doing it incorrectly. They might be using the wrong form, the wrong dose, taking it at the wrong time, or combining it with things that block absorption. All of this not only fails to prevent nerve damage, but can actually make things worse. Some people even mask serious deficiencies or create dangerous interactions with medications, leading to complications like blood clots, kidney problems, or accelerated cognitive decline. As someone who has treated thousands of seniors for B12 deficiency and peripheral neuropathy, I've seen firsthand what can happen when this vitamin is not used properly. Patients often come in after months or even years of taking B12 supplements, expecting relief, only to find their numbness and pain worsening. In many cases, they're taking cyanocobalamin, the synthetic form of B12 that your body has to convert through several steps to be useful. This doesn't work well for a huge portion of the population because of common genetic variations. Others are taking extremely high doses, 5,000 to 10,000 micrograms daily, thinking that more must be better. Unfortunately, these high doses can deplete folate, making neuropathy worse, hiding serious anemia, and allowing irreversible nerve damage to progress quietly. Some seniors unknowingly combine B12 with medications that interfere with absorption, take it at the wrong times, or swallow sublingual tablets immediately instead of letting them dissolve properly. Others take supplements without addressing underlying absorption problems like atrophic gastritis, pernicious anemia, or the effects of medications such as metformin. In these cases, no matter how much B12 they take, it simply won't work, leaving their nerves vulnerable. The statistics are alarming. Between 10 and 25% of adults over 60 are B12 deficient, and the rate jumps to over 40% in adults over 80. Deficiency causes devastating neurological issues, including peripheral neuropathy with numbness, tingling, burning pain, weakness, and loss of balance. It can also cause subacute combined degeneration of the spinal cord, making walking difficult, affecting bladder control, and contributing to cognitive decline and dementia. Depression and mood changes, along with severe fatigue from megaloblastic anemia, are common. The frightening part is that all of these consequences are entirely preventable with proper B12 supplementation. But the word here is proper. Taking B12 incorrectly not only wastes money on supplements that don't work, but creates a false sense of security. People think they're protected when they are not, and deficiency silently progresses, causing irreversible nerve damage. Certain mistakes like using the wrong form, taking massive doses, or ignoring absorption issues can actively cause harm. Research published in reputable journals including JAMA, the New England Journal of Medicine, and Neurology confirms that seniors frequently make these mistakes, and it also lays out evidence-based guidelines for B12 supplementation that actually works. In this video, I'll guide you through 7 critical mistakes seniors make when taking B12, starting with the most common and ending with the most dangerous. Mistake number 4, which can cause permanent nerve damage in up to 40% of seniors, despite taking supplements they think are protective. These aren't minor errors. They're serious mistakes that can leave your legs and feet damaged, mask pernicious anemia, interact dangerously with medications, and waste money on supplements that will never help. One of the most frequent mistakes is using the wrong type of B12. Many seniors take cyanocobalamin, the synthetic form found in most cheap supplements, instead of methylcobalamin or hydroxycobalamin, which are the active forms your body actually needs. Cyanocobalamin doesn't exist naturally in food. Your body has to convert it through multiple enzymatic steps to a usable form, a process that becomes much less efficient as we age. Around 40 to 50% of the population has a genetic variation, commonly called MTHFR, that reduces this conversion even further. That means taking cyanocobalamin is essentially like filling your gas tank with diesel. You won't get the results you expect. Studies show that in older adults, methylcobalamin increases blood B12 levels 200 to 300% more than cyanocobalamin, and significantly reduces neuropathy symptoms within 8 to 12 weeks. On the other hand, cyanocobalamin often shows little to no improvement, even when blood tests appear normal. The reason cyanocobalamin is so common is cost and shelf stability. It's cheaper and lasts longer. But it's simply not effective for most seniors, especially those with impaired B12 metabolism. The bottom line is this: if your supplement label lists cyanocobalamin, it's time to switch to methylcobalamin or hydroxycobalamin to actually protect your nerve. For seniors using oral supplements, methylcobalamin at 1,000 to 2,000 micrograms daily is ideal. Hydroxycobalamin injections are preferred for rapid restoration, as they stay in the body longer and can be given weekly or monthly. Many practitioners recommend starting with injections to restore levels quickly, then maintaining with oral methylcobalamin. Another common mistake is starting supplements without testing your actual B12 status. Many seniors begin supplementation based on vague symptoms or general recommendations without knowing if they're truly deficient, what type of deficiency they have, or whether oral supplements will even work. This is especially important because B12 deficiency is rarely caused by diet alone. It's almost always due to absorption problems. Now, let's talk about another major mistake: taking massive doses of B12, thinking that more is always better and completely safe. Many seniors believe that because B12 is water-soluble, they can't possibly overdose, so they take 5,000, 10,000, or even 50,000 micrograms daily. This approach affects about 30 to 40% of seniors who take supplements, often based on advice from online sources or friends. The assumption is that huge doses will make up for absorption problems, but the reality is very different. While it's true that B12 has very low toxicity and excess is usually excreted in urine, chronic megadosing can actually cause harm. High doses of B12, particularly cyanocobalamin, can deplete folate, which works hand in hand with B12 in critical pathways for nerve and blood health. When folate is depleted, it creates a paradox. Neuropathy worsens even while taking huge amounts of B12, and dangerous conditions like pernicious anemia can be masked. Folate deficiency also elevates homocysteine, a substance linked to heart disease and dementia, the exact issues we aim to prevent with B12. Research shows that doses above 2,000 micrograms daily can increase oxidative stress and DNA damage, especially if sustained over months or years. Extremely high B12, particularly cyanocobalamin, releases cyanide during metabolism. While small amounts are normally cleared by the body, massive doses can overwhelm detoxification, increasing risk rather than protecting nerves. Studies tracking thousands of adults found that serum B12 levels above 1,000 picograms per milliliter, levels usually reached only by megadosing, were associated with 20 to 30% higher mortality over 10 years. Here's the crucial point: moderate, evidence-based doses are highly effective. For prevention, 500 to 1,000 micrograms daily of methylcobalamin works beautifully. For treating confirmed deficiency, 1,000 to 2,000 micrograms daily is sufficient. There's no benefit above 2,000, and there may even be harm. If you've been taking megadoses, you need to scale back and also ensure adequate folate, around 400 to 800 micrograms daily, to prevent induced deficiency. Now let's get into the most dangerous mistake of all, and one that leads to permanent nerve damage in nearly 40% of seniors despite supplementation. Taking B12 without addressing underlying absorption issues. This is where most seniors unknowingly fail. The truth is that B12 deficiency in older adults is rarely caused by diet alone. Most often, it's due to impaired absorption in the stomach or intestines. Taking oral B12 supplements in this situation is like pouring water into a bucket with a huge hole. It won't fill up, no matter how much you pour. The most common culprit is pernicious anemia, an autoimmune condition affecting 2 to 5% of adults over 60 and up to 10% of those over 80. In pernicious anemia, antibodies attack the stomach's parietal cells that produce intrinsic factor, a protein absolutely required for B12 absorption in the small intestine. Without intrinsic factor, oral B12 is absorbed at less than 5% efficiency. Oral supplements simply won't work. The sad reality is that this condition is easily diagnosed with blood tests for intrinsic factor antibodies and parietal cell antibodies, yet these tests are rarely performed. Seniors unknowingly take oral B12 for years, while progressive nerve and spinal cord damage silently develops. Another common absorption problem is atrophic gastritis, which affects 30 to 50% of adults over 60. In this condition, stomach acid declines gradually, reducing the release of B12 from food. Without adequate acid, dietary B12 can't bind to intrinsic factor, preventing absorption. Unlike pernicious anemia, intrinsic factor is still present, so high-dose oral B12 can still work through passive diffusion. But standard multivitamin doses of 6 to 25 micrograms are completely inadequate. Seniors need 500 to 1,000 micrograms daily to achieve meaningful absorption in this scenario. Even common medications can interfere. Metformin, the diabetes medication used by over 10 million Americans, reduces B12 absorption by 30 to 40% by affecting intrinsic factor binding and gut bacteria. Long-term users are at substantial risk, yet B12 monitoring is rarely recommended until symptoms appear. So what must you do? First, determine if you have absorption issues. If pernicious anemia is diagnosed, oral B12 will fail completely. You need intramuscular injections of hydroxycobalamin, typically 1,000 micrograms weekly for 4 weeks, then monthly for life, or high-dose nasal sprays that bypass the gut entirely. If atrophic gastritis is present, high-dose oral methylcobalamin, 1,000 to 2,000 micrograms daily, is effective. If you take metformin, daily supplementation is essential, and levels should be checked annually. Taking B12 without knowing your absorption status is guaranteed to fail, and progressive nerve damage can silently worsen. Another common mistake is taking B12 at the wrong time or with things that block absorption. Many seniors take all supplements with breakfast or dinner, unaware that timing and combinations can reduce absorption by 50 to 80%. Vitamin C over 500 milligrams can destroy B12 in the gut. Iron supplements, particularly ferrous sulfate, compete for absorption and reduce effectiveness by 40 to 60%. Proton pump inhibitors and H2 blockers used for reflux reduce stomach acid, raising deficiency risk by up to 80%. Alcohol consumed with meals can also impair absorption by damaging the gut lining and interfering with intrinsic factor. Even high-fiber meals can delay gastric emptying or bind B12, reducing absorption. To maximize B12, take it on an empty stomach, ideally first thing in the morning, at least 30 minutes before food. Separate it from vitamin C, iron, or other supplements by at least 4 hours. If taking acid-blocking medications, consider higher doses or alternative delivery like injections. Avoid alcohol near B12 dosing. Simple timing adjustments can double or even triple absorption effectiveness. Now let's cover mistake number 2, which affects about 50% of seniors using sublingual or under-the-tongue B12 tablets. Many people think that placing the tablet under the tongue is enough, but then they swallow it immediately with water. This completely negates the purpose of sublingual delivery. The idea behind sublingual B12 is to bypass the stomach and intestines, allowing direct absorption through the thin, highly vascular mucous membranes under the tongue. This method is especially beneficial for those with absorption problems like pernicious anemia, atrophic gastritis, or gastrointestinal diseases, because it doesn't rely on stomach acid, intrinsic factor, or intestinal absorption. However, sublingual B12 only works if you allow it to fully dissolve, which typically takes 10 to 30 minutes. Swallowing too soon sends the B12 to your stomach, where it may be partially destroyed or fail to absorb adequately. Studies show that when used correctly, sublingual tablets increase blood B12 levels 40 to 60% more than equivalent oral doses. If swallowed immediately, blood levels are almost identical to regular oral tablets, defeating the purpose entirely. Many seniors find holding a tablet under their tongue for 20 to 30 minutes tedious, uncomfortable, or unpleasant in taste, and they often give up early. If this happens, there are workarounds. Liquid sublingual drops absorb faster, usually within 5 to 10 minutes. Injections or high-dose nasal sprays are other convenient alternatives that bypass the gut entirely, ensuring proper absorption. The bottom line is that proper sublingual use is not optional. It's essential for effectiveness. Finally, the number one most dangerous mistake is not monitoring your response with follow-up testing. This mistake affects over 80% of seniors taking B12. Many assume that because they are taking supplements, they are protected from deficiency and nerve damage. But without testing, you have no idea whether B12 levels are actually rising or if treatment is effective. Treatment failures can go unnoticed for months or even years, allowing irreversible nerve damage to progress silently. There are many reasons supplementation might fail. You might be taking the wrong form, like cyanocobalamin, or have undiagnosed pernicious anemia that requires injections. Doses could be too low for the severity of your deficiency, absorption could be blocked by medications or health conditions, or timing could be completely wrong. Without follow-up, you're flying blind. Studies indicate that 20 to 30% of patients taking oral B12 fail to achieve adequate repletion within 3 to 6 months, despite taking supplements as directed. Poor absorption, the need for injections, inadequate doses, or interference from other factors are common culprits. In these cases, neurological symptoms continue to worsen because treatment is insufficient. Research shows that neurological damage becomes irreversible if deficiency progresses beyond 12 to 18 months. Early diagnosis and treatment within the first 6 to 12 months allow near-complete reversal. But after 18 to 24 months, even aggressive treatment often results in permanent neuropathy, balance issues, and cognitive deficits. What must you do? After starting B12 supplementation, recheck your levels in 2 to 3 months to confirm effectiveness. Testing should include serum B12, methylmalonic acid, MMA, and homocysteine. Adequate treatment should raise serum B12 to at least 400 to 500 picograms per milliliter, lower MMA below 270 nanomoles per liter, and reduce homocysteine below 10 micromoles per liter. If follow-up tests show inadequate improvement, your treatment strategy has failed. You may need to switch from cyanocobalamin to methylcobalamin, adjust your dose to 1,000 or 2,000 micrograms, change timing to an empty stomach, eliminate interfering substances, or switch to injections if absorption problems exist. Continuing an ineffective strategy, hoping it will eventually work, is a recipe for irreversible nerve damage. These 7 mistakes, using cyanocobalamin instead of active forms, not testing before starting, megadosing, ignoring absorption issues, poor timing, incorrect sublingual use, and no follow-up testing, explain why so many seniors develop leg and foot nerve damage despite taking B12 supplements. Correcting these mistakes isn't just smart, it's essential for protecting your nerves, balance, mobility, and overall health. Take a moment to reflect. Which of these mistakes might you be making? Understanding and correcting them now could prevent irreversible nerve damage, loss of independence, and serious health complications. B12 deficiency is highly preventable, but only with proper testing, dosing, timing, and monitoring. If you know someone over 40, 50, or 60 who is taking B12, share this information. It could save them from years of pain, numbness, tingling, and preventable nerve damage. Remember, it's not just about taking a supplement, it's about taking it correctly, understanding your body, and ensuring that what you're doing is actually protecting you. Subscribe to our channel for evidence-based senior health content and stay informed on how to protect your nerves, brain, and overall vitality with the right strategies. Don't wait for symptoms to appear. Prevention is the key, and the right B12 strategy can make all the difference.